Services, December 10th at 6:30. Roll call, please.
1 second here. Could we ask the person with the phone number to mute their mic? We're getting back feed. Okay. Kay Wilson, Tweed Schuman, Marshall Savitsky.
Here.
Tweed, was that you?
Yes, I'm trying to, but everybody keeps muting me.
Okay, we're getting back feed from your mic somehow. Chuck Van Etten, Jeff Haney, Bill Trepanier, Don Pettit,
Here.
Carol Pearson, Sabrina Dunlap. You have a quorum. States of America, and to the republic for which it stands, one nation, under God, indivisible, with
with
liberty.
liberty and
justice
justice
for
for all.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
We have an agenda for this evening and we are removing item 10. Any other changes? All right. Public comments. Approval of the minutes from our previous meeting. Motion's been made and seconded. Any discussion? All in favor?
Aye.
Opposed?
Aye.
So carried. Committee reports. Administration. Andy?
I don't have anything
Okay.
specific to update on.
All right, we'll move on to adult long-term care. Okay. I do have a report for there.
Okay, they have seen an uptick in cases coming into the ADRC post-Thanksgiving, as many people spent time with family members and may have started noticing some changes in their ability to function. So we typically do tend to see an uptick around the holidays when families are spending more time together. So once we get through Christmas and into the new year, that should settle down a bit. These microphones are loud. If you recall, Carol Martin was our former elder benefit specialist. She moved into the supervisor position. Hank had then was our disability benefit specialist. He moved into the elder benefit specialist. And that position of the disability benefit specialist was a position that was shared by both Price and Sawyer County, and he covered there. That position has now been filled by Price County, and Lita Mason is our new DBS. Hear outstanding things about her, and she has been in our office on most Wednesdays and has had appointments every time she's been there. So it's been a good transition. What is not being such a great transition right now is the state has transitioned how the ADRC specialists enter their information into a database. There was an old antiquated database. They moved into a newer one that, of course, they assured was going to be so much better. They're struggling with it across the state right now. And so they're doing the best they can to get information in. Once we start getting understanding that, it looks like we're going to be able to get good data and information out of it. It's just taking a while to transition. The other thing that is happening is the ADRC will also be is getting a new logo and tag. It does not look a whole lot different than the original one did. And this is something that's put through from the state. We do receive funds for marketing and signage as part of our consortium as we work together. The decision has been made not to change any of the current information. We're just going to keep moving forward with it. And then as we need to replace, we'll replace with the new logo. But there's no sense in destroying things that are still viable and usable. And then the final thing is that open enrollment did get completed for December 7th. So we should have some updated numbers by the time we meet again. That ends the report for adult health services.
Next would be behavioral health.
Okay, with the behavioral health program, as you know, Joe Bodo did put his resignation in last month. And we're starting to look at what all is happening in those areas and how we're going to transition some of those services. We're still working through some of that. We do know for sure that OWI can continue to be done by Haley, and that Alicia will be able to oversee that program. We will see a decline in our CCS program, which does make some capacity with Haley to be able to potentially move her into supporting some CLTS. That is a position that is open right now for us. So for right now, I have to meet with Andy and Rose and kind of talk through some things. So kind of on the edge. I just got back to works after being out for quite a while. But looking at potentially being able to make sure that we're supporting that system while we're in transition. Other things with the mental health pieces, moving into the mental health monthly expense report, nothing too outstanding there. I think one of the key things as we move into the next report, which is the cost by client report, and we have those 4 clients on there. Looking at hopefully one of the clients will be able to go into a long-term care functional ability, so that will take them off the books. And next year, really needing, as Carrie and I kind of move through some of these other projects we've been working on, I think we need to be looking at an RFA to try to determine if there is more reasonable housing type of situation for client B. That will most likely continue to need pretty restrictive placement, but is there a way that we can do that at a less costly expense? I didn't get a chance to talk with Joe. I know he mentioned something about transport options. Andy, I don't know if you talked with him or have any updates, or if that needs to just go on next month.
What I talked to Joe about is there's a transport firm that's opened up in the area. Both the sheriff and police chief Savitsky are aware of it. And then they were talking between the chief and the sheriff on transport options between the two of them and sharing of deputies between the departments to make those transports happen. As of the last time I had talked to Joe, though, we didn't have a contract or any proposed contract to use the new private entity that's available.
Okay. Any questions in the behavioral health area?
Let's move on to child protective services and youth justice.
Sarah, did you want to go ahead and report out?
So in youth justice, we were, I guess, over a little bit of time, we've now been awarded with 3 different grants for a total of $389,724. We are planning to use part of that funding to, we've created a diversion and truancy type program. So we're going to start to implement that in January of 2025. This program is designed to kind of be more preventative and be at the front end of things to hopefully keep more juveniles out of the formal court system. We are going to be taking referrals from schools, and what will be some of the requirements is that it has to be kids ages 10 to 16. And it has to be realistic that if we get them going back to school, that they have a chance of graduating. The other thing that we are going to use the grant funding for is we are contracting with a program called Sorona, and they will work with us to do the hiring of this individual, who will be more of a community outreach, community partner type of person, and be kind of assisting youth justice and the diversion program with being able to go into clients' homes with families and work on building communication skills, work on empowering parents to implement consequences and rewards, and really do some of the building that our families need. And we're hoping that that will start to make a little bit of a difference in our county.
Anybody have any questions for Sarah? Sorona Recovery is actually a sister to Justice Point, so they're under the same umbrella. We've had really good luck with Justice Point in our diversion programming that we have with the county, so we're really happy to be able to work with Sorona as we move forward. So that will help keep that connection with Becky Berry and Justice Point going too.
I would add that these grants were very selective. The bigger federal grant that we got, they were very selective in which counties they selected. And was there two, or were we the only one?
There was the federal one when there was only 2.
And so we were lucky enough to be one of the counties that were selected because of Carrie, Julia, and kind of my joint collaboration to really express the needs of Sawyer County. And the feedback was that we were the type of county that they were exactly looking for, because we're so rural and our services are limited, and we definitely meet the need.
The last one that we just got, we beat out, we found out that there was multi-counties that actually applied for it to get the grant, and we beat them out. They didn't get it. So it's like, okay, hopefully now we can make some good things happen with this. So we had our fingers crossed, but I certainly didn't think we'd get 3 for 3.
Congratulations. That means you're good grant writers.
Yes, Carrie coming on board has been huge.
I give her most of the credit. She really did a phenomenal job.
Yeah. Thank you, Sarah. Okay. Economic support. Shauna's got her standard information in here. I do have one piece to share. There isn't anything too outstanding from the report, but I am going to go ahead and replace your share there with this. I just wanted to bring forward that we do run the WEAP program, which is the Wisconsin Home Energy Assistance Program. It's a weatherization program, provides heating costs, electric costs, and energy crisis situations. They do provide weatherization to help renters and homeowners, and they can help with like heating systems, leaky non-working water heaters, leaky faucets, toilets, and pipes. This is federal and state funding. And we believe that probably not as many people realize that they're eligible for this as could be. So we're going to be doing, it's not sharing, is it? Shoot. Let's try it one more time. Let me hit share. Okay, let's see. Let's go back here. Now is it sharing? There it goes. And this was just actually more what I wanted to show anyways, was if I can get the screen to come up. There we go. There's probably quite a few more people eligible for this programming than what people think there is. So we're going to try to get some good advertising out there to allow people to kind of come in and get additional assistance because we're not seeing people use it quite as much as we know there should be eligibility for. So just wanted to put that out for everybody. And they do a wonderful job with the program.
Is that for energy assistance?
For energy assistance, yep, yep. And it's something that not all counties do keep it as local. Some of them actually contract out, just like we contract out for other services. But it seems to work really well. We are able to use people who do work the call center and also then can work the WEEP stuff in the fall. They kind of pick up hours during the time and then drop off hours. So we have some very flexible staff that are willing to do that. So it works out really well for us. Okay, I don't have anything else on economic support.
Public health?
Julie and Matt, I'll have you guys take over.
Okay, I will be brief. Just to let you know, we are seeing a slight increase in influenza and RSV cases. However, we're still at low levels, but it's not too late to get vaccinated. So we are encouraging that. I did want to highlight too that our teen birth rate out of all the counties in Wisconsin, we made the largest decline in teen birth rate trend data. Wisconsin and national numbers have been declining. It just happened to be that Sawyer County had the largest decline between trend data from the year previous to this year. So did want to note that as well. And if there aren't any questions, I'll defer the rest of my time to
Can that
Matt.
be attributed to a specific program that was run or?
Well,
Why?
we've seen, so there are national numbers that are declining as well as state numbers. We're following that national trend just at a greater level. We do have reproductive health programs in schools. We do partake in and help with education. There are community organizations that also partner. I believe it's a community effort with access to care, with providing resources in our community as well. Know if you want to. It happened, the trend data happened under Julia as
Well,
well.
it
so.
happened all through. Yep, and I think it's just really that open access and getting that information out and being a trusted resource in the community and knowing where people can go for services.
It's multiple partners.
Go ahead.
Have you seen an increase in the visits that you guys have that are for reproductive health?
In the last quarter, we have seen increases. We were pretty steady, and I think I highlighted that on last month report. I don't have the numbers in front of me, but we are seeing increase in request for care and client numbers for our reproductive health. And we do community outreach as well.
Good.
Yeah.
Good news.
The rest of my time will be Mr. McKay.
Good evening. So I was just asked to kind of give a couple updates here, mostly on tourist rooming houses. And one of the things that has been discussed from my understanding from last meeting is the size of tourist rooming houses and some maybe discrepancy on size versus number of rooms and keyed units and stuff like that. So I'm trying to maybe clarify that a little bit. So regardless of the size of the overall structure that's looking to get a tourist rooming house or short-term rental license, there is no size limit based on square footage or cubic footage or anything like that. Tourist rooming houses are licensed based on the number of units that they're looking to get licensed. And so a tourist rooming house license is good for 1 to 4 units. If they have more than 4 units, then they're getting moved up into a different category in the lodging facility. So like if you look at a hotel unit that has 90 rooms, they're going to be bumped into a lodging license that is fits like the third tier of criteria, I guess, for based on the number of rooms that they have available. So it's a tiered process. So the more rooms that they have, the higher fee that they're going to pay for a license. But again, for tourist rooming houses, just because they have 3 bedrooms, 5 bedrooms, 10 bedrooms, 12 bedrooms or more, there is no fee structure for number of bedrooms in a unit. So, whereas again, where it's the state ATP 72, the code is based on the number of keyed units. Again, number of units that are individually rented by different parties. So again, hotel rooms. So there's been a particular facility that has been in question over the last couple months, and just want to kind of give an update on that particular facility based on the information that was being put out there on social media or different platforms such as Airbnb or VRBO. So we have gotten that information corrected. So we've talked to the individual homeowner as well as the manager for that property. They now are up to speed with some of that information had been given to them in the past, but now that we can see what they're advertising, we got that corrected. So they are now posting on their social media pages what our new ordinances have outlined. So they have corrected that as of today. And the other part of it too is more of a zoning situation where this particular facility was looking to operate 2 rental units on the same license, which would be in conflict of a zoning ordinance. And so made that clear as well that they could only operate and rent to one particular party, not 2 separate ones, if that makes sense. So that's all straightened out. So I'm hoping we have that particular facility all taken care of, and we shouldn't have to spend any more time on that one, hopefully. So any questions on that, I guess, at this point? Okay. The other thing asked to update on was just overall implementation of the new tourist rooming house ordinances. So just kind of give you a quick synopsis of what's been going on since the adoption of the ordinances. So we're putting together a letter that we are hoping will go out this week, but we are kind of waiting for the ordinances to show up in the Muni code. There was a delay getting that out, and so we want to be able, when we send out the letter, we want to have a direct link to that Muni code. So once that Muni code is available, we will then get that letter out. The letter will be going out to all our existing tourist rooming house licensed facilities. That would just be a mass email push to get that out as quickly as possible. Envision there'll be a lot of questions with that. So we are preparing an FAQ as well, but we want to see what some of those questions are so we know where everybody's kind of spending their time on what questions that they have and where we need to answer. But again, we have a lot of that put together already. In the meantime, we've also been exploring services from a company called Granicus. We currently work with Granicus to help us identify tourist rooming houses in Sawyer County that may or may not be licensed. So they do a scrub of all the different facilities and platforms out there. Again, Airbnb, VRBOs, FlipKey, all the subsidiaries. And then they put this on like a dashboard that we have access to. And so about once a month or so, maybe quarterly, we do a push to find out what facilities are not licensed. And then we send out, usually a dozen, on average, a dozen letters informing them that they need to have a license and that they're operating illegally. So, and then we get pretty good compliance with that. Sometimes we do have to send a second letter, but anyways, we're using Granicus to help us with that. They have a service also, it's a 24/7 hotline where that would help us with any complaints that would come in. And some of the features that this service offers is that they would they can email into as well, but call in, they'd actually get an operator that answers. They provide all their information. They can upload photos and any other evidence or documents. And then the operator actually will then, based on any information that we have for the owner or the owner's agent, they would actually reach out to that phone number, contact them, try to get a hold of them so that they can try to get immediate resolve to whatever the situation is. And then they will actually follow up. They will contact the complainant to see if the situation is resolved. And after a certain period of time, whatever we determine is appropriate, they will actually call the owner or owner's agent to see what they did to resolve the situation. So and that's all documented. They take care of all that. So it's a really nice program. I think it'll help us a lot for not only try to get resolve of these situations quicker, but also help document all that information, and we can pull that and query that information out at whatever time is appropriate. But
Matt,
yes.
how is the public going to know about that particular service?
Right. So in the ordinances, we had made a requirement that every homeowner will need to post that signage.
Mhm.
So in there, we had stated that we would put our Sawyer County complaint website, right? In place of that, we would then put if we choose to go with Granicus, we would then implement their information and like a QR code or whatever is easiest to get them to a phone number and like a QR code, then that would get them to their services.
So that would be on the signage that people are obligated to put on the road.
That's one way for sure. Yep, that would be that avenue. We would be putting it on our website as well. And
Under Health and Human Services?
yes, on our tourist rooming house.
Sorry, well, we could probably even do more of a direct link because there's like, how do I file a complaint?
Right.
Like just on the main page. And so I think that would be another way.
Good.
And
That would help you a lot with people calling you.
oh, for sure.
Yes.
And yeah, just the documentation and seeing follow through. It would be for our staff to try to do that and monitor all that. It would be difficult. So we also look for assistance from our code enforcement officer as well.
Is this an expensive service?
So they gave us a quote of $9,000 to $10,000. I think the first quote was 10,000, and they came back with a slightly lower number. I want to say it's somewhere around mid 9,000.
For how long?
An annual.
An annual fee?
Mhm.
Well, that's not bad. Well, I don't think.
Not for the amount of work that
No.
goes into that. And yeah.
That was part of our budget for the fees as well.
Yeah.
Other things, so I had a meeting today with our IT folks, Mike, and to try to develop a database for record retention for our licenses that are now going to be required for the rental properties, the Sawyer County license, and looking to utilize Novus like zoning does currently for their permits and POUTS information. So after today's meeting, I feel real good. I didn't know going into what the limitations were, what even outlining what our needs are, but felt real good by the time we were done that this will be feasible to use Novus and that this will be a good tool for us to keep our information in there and have zoning and our department to have access and update the information as well. It is going to take some time to develop that. Novus is not an easy happen overnight type software, so it's going to take time to build that because it's a custom build for our needs. And our hopes is that goal would be to try and have it in place and using it by April 1st. That's kind of our goal. Also, we've been working on an application for facilities to get their license. This would be for new facilities and would be for our existing facilities when they are going to be requiring a license. We're going to do all that big push between April 1st and July. I'm sorry. Starting April 1st. Sorry. That we're going to try and get the application out to all our existing facilities. And because at that time is also our state annual renewal of the current state license. So we're trying to do it all in one process at one time. So it's not as confusing. So it'd be one application. Obviously, they're going to be getting 2 separate licenses. So the application is just about pretty much done. Might need to run it by Corp Counsel to just verify the language that's in there, that it's all good. So we should have that done here fairly soon. Working on an FAQ document as well. And then we have our information packet. This is going to be so when a new facility comes on board, and we'll send it out to our existing facilities when the beginning of April. This is kind of like everything they're going to need to know to get up and going and licensing, all the requirements, all the recommendations that we're kind of putting out there to make sure they can get their license, that they don't have any violations. If they follow that, they'll be doing really well. And some good neighbor practices as well. Another thing that we talked about, the plaque card. So because it is a requirement from the ordinances, this is kind of a template that I put together so that way we have something to show the owners what information they need. It's listed in the ordinances, but what I'm hoping to do is if we can get somebody to make them cheap enough to maybe just incorporate. What I want to stay away from is people just laminating a sheet of paper, writing in their information and putting it outside, because these aren't going to hold up. And so would like to see if we can get a placard that would kind of be pulled up in the elements and be UV protected. They can fill in their kind of like a no trespassing sign, like that type of material, and then they can write in their information. And that would stand up to the elements for a year or two, at least to get them started, because this is a new requirement. After that, they'd be on their own to try to maintain that sign. And if they need to replace it, they'll be on their own to do that. Maybe we would have them available here to sell for cost or whatever, but getting a quote on that, and hope to have that information here in the next week or two. But I don't have any prices on those at this point. Of course, we've been doing a lot of education since the ordinances have been signed and gone through. Everybody that calls for a new license or even existing license owners, when we go out to do our annual inspections, we are talking to all of them, informing them of the new ordinances, and trying to address any of the questions that they have. So the big thing that the question that everybody has is like the kind of the timeline of enforcement, and by no means is that easy. And so try to lay out a little bit of how we see it unfolding. As I mentioned, April 1st, well, let me go back a little bit. Starting probably January 1st, any new facility, we will be requiring them to address occupancy based on the ordinances. So we'll be working with zoning to get that information and make sure that when we go out to do a pre-inspection, that they are set up so that they are not exceeding that occupancy limit. The hard part is trying to do that right now with not having all the tools in our tool belt right now. So a lot of this is in motion, and we're trying to get everything developed and put together, but it's hard to enforce these ordinances since they just happened, and then expecting them to be fully on board with those ordinances. So we got to have a little grace period to educate them and get them to where they need to be.
Are you talking existing short-term rentals?
Both new and existing, right? So new ones, like I said, starting in January 1st, we'll make sure that we are working with zoning to find out what their septic size is, and try, when we go out to do that pre-inspection, we'll say this is your limit. It's hard, the enforcement's going to come with looking to see what they're advertising for. That's really we're going to be using Granicus as a tool to see what they're advertising for. Excuse me. And that's going to be how we kind of enforce things. But if we get calls or something like that, when we observe it, we'll enforce it that way too. But when we go to do a pre-inspection on a facility, they aren't advertising yet because they can't, because they don't have a license. So we can't really see and enforce anything because they haven't actually been operating yet, right? So all we can do is inform them and hope that they're not. So we have to do maybe some monitoring after they're up and going, and kind of watching those platforms.
But at least they know what the rules are.
Right. So yeah, the big part is right now is going to be education.
Right.
It's not until we get everything fully up and going and running and in place where we can really start doing that, first time warning, second time a citation, third time, 3 strikes, maybe it's a loss of license. But until we get set up, it's going to be more education at this point. And then with the existing facilities that are already licensed, again, July 1st is going to be that kind of that cutoff. They are going to need to be their websites that they're advertising on will have to show that they are indeed advertising based on occupancy set by zoning. Now, enforcing that for the summer of this next year for 2025 is going to be the difficult part because people have already booked. They booked this last summer. So there's going to be some flexibility on enforcing that throughout the summer. I guess probably the hardest question to answer is at what point then do we are no longer flexing, but then we're starting to implement the ordinances next year after, say, the summertime. So whether we do like after Labor Day of next year, or we wait until January 1st of 2026, that's something we still kind of got to flesh out as to what makes the most sense and what is appropriate and fair, I guess.
But we would be able to monitor the platforms and make sure that they're advertising appropriately.
Well, you think about the Berkey coming up and people always reserve their space.
The year before.
Yeah, right away. So.
Right. So it's like, and we're not going to go in and say, oh, no, yeah, people that booked last year, you can't let them stay there because they're over. We're not going to ruin people's vacations based on that they booked 6 months ago. So, yeah, that's the hard part right now is trying to decide what's enforceable when. But as far as other things that we are going to obviously enforce starting as of when the ordinances were signed would include like calls for service and anything related to complaints, that kind of thing. And those other rules about parking and garbage and campfires, that kind of stuff, those all can be enforced at any time now. So I don't know, any questions, I guess? Sorry, that was long-winded, but there's a lot to cover in a short time.
No, I don't have any further questions. Anybody? Marshall? Tweed? Any questions? Chuck?
One of my questions then is going to be to Andy when we're doing all this and we're going to allow so much to hire personnel. Does this offset hiring the additional personnel or is this in addition, this $10,000 to hire this service?
That was included in the, may try to answer based on your question. The hiring of staff was in addition to the service. We included the service as well as the staff cost in there. Now, to go back to what we had discussed though, is we aren't going to run out next month and hire staff. We're going to talk about a LTE or available staff to help with this licensing process to get it done before July 1st. And then we'll see where we are before we hire any full-time staff.
Thank you, Matt. Fiscal.
Okay, all the standard reports are in. Nothing is stepping out at me any different than what I've reported on in the past. Unless anybody has any questions, I would jump down to E and go over the opioid settlement fund update. which would be new information for you to see. I've got a report that I'm going to put up on the screen, but it's a little bit more, excuse me, difficult for you guys to be able to see. So I'm going to pull it up this way. I think this is it. Okay. This was the report that I was intending to have in the agenda last month. So that's why it says 2024. I did bring this also to CJCC, and I'll cover a couple of things that I've talked with them about too. So opioid budget and expenses from August 2023 to October 2024. We had actually budgeted $127,650 from the opioid funds. In 2023, we only spent $17,300. And in 2024, we're projected to expend about $30,000 for total expenses of just under $50,000. So that gives us a budget of that we're under by $80,000. And it's not that we haven't done anything. We'll be going through all of the things that we've done, but what we've been doing, and I've talked about this before, is blending and braiding other funding resources that come through. So if we find that there are grants available to get Narcan or grants available to do X, Y, and Z, we're using that grant funding first that's more specific and allows us to then allow our opioid dollars to go be drawn out further. Even though with these funds, we have to spend them on kind of specific types of things, we don't have a time frame of when it has to be spent by. So we're just trying to be as smart as we can with this. I won't go through every single line item here, but I'll kind of highlight some of the things. So we have become a Narcan distributor through grants. We've done evaluation of supervised injection sites, which we're not going to do. We don't need that. These are kind of all harm reduction strategies that you'll find outlined in some of the exhibits that we're to use. We've evaluated clean needle exchange. We're not going to be doing that. We've provided lots of fentanyl drug overdose training to school and staff. Over 35 people have attended. We're in the process of working on vaping education points. We've done a survey with the YJ clients. They've interviewed over 60 jail inmates, and we're going to continue to do those surveys or interviews until we reach 100. We're trying to identify people who have lived in our community and understand things that could have been or should have been implemented and might have helped prevent or help them through their drug abuse or misuse, and be able to help them through recovery. We've worked on prescribing guidelines. We're working on connecting hospital and clinics to not be using, I'll kind of go back on this. Back in the day, pharmaceutical reps used to come in and be able to give doctors all kinds of things for prescribing their medications. We've made sure that our hospital and clinics are no longer, usually they put policies in place and that's all been taken care of, but we wanted to validate that. Participating in drug take-back days, collaborating with the Prevention Use Coalition, community overdose education at Seven Winds Casino. We have created a peer counseling program. There have been over 700 flyers handed out about substance use. We've collaborated with Namakan Transit to make sure that the bus stops with treatment providers. The hospital will now provide a 3-day supply of Suboxone and a warm handoff for anybody coming in with an overdose who wants this. We've done MAT training and recovery court steering committee. So lots of things that have happened, and we've been able to do that with the funds that we were able to kind of pull together. The question is how do the funds work and how did we decide to move forward with things? We have funds that will be coming in over time. They're going to go through 2038. The distributors in Janssen and then the pharmaceuticals and the pharmacies, they all have different payouts times, and I've kind of aligned that here. So you can kind of see that as of October 2024, we have received a total of 316 or almost 317,000. By the end of 2025, we'll have gotten another 27,000. And then each year you can kind of see what we're expecting to come in line over time. And it's really going to get us only to about $1 million. And that's to be used through 2038. So how do we best use these funds and get the biggest bang for our buck out of them? Obviously, we're going to still do the blending and braiding, but looking at how do we budget the use of our dollars over time. And my recommendation would be to try to use a higher dollar amount in the first number of years to really start pushing these services forward, get good things in place. And then as we start seeing those payments reduce, we would have the reduction in the ability to spend the funds. So my proposal to CJCC was to really kind of start focusing on a $100,000 budget each year through 2029 and then start seeing those expenses drop. Some of the things in the 2025 in budget proposal, we would be looking at, I'm wondering if I've got this in the right order, but I don't. I got my 2 pages mixed up. So the 2025 budget proposal, we have this Exhibit E that's in the left-hand column. Those are all things that that we have to make sure that the funds that we use fit that category. So I've done a proposal. We do know that the billboards and the work in the schools and the advertising are working. We're hearing that from people. So would recommend continue to do that. Drug take back has been a huge success for us. I'll come back to this treatment one. Go into recovery. We do have our 2 peer recovery coaches. We work through AmeriCorps for that. So we get 2 full-time coaches for $16,000, which is a great use of our funds. And sober activities and events for youths and adults, that's really trying to help provide those outlets where people can connect without having any alcohol or drugs around. And then we've been using our marketing and our staffing to help support. So one of the things that's kind of sitting out here is the highlighted area, support for members suffering from trauma due to addiction in the MAT in jail. I don't have a number on that. It's 22, I have 22,000 about left in the budget. One of the recommendations from our committee actually has been to help support families who are taking in kids from their children or grandparents, or they're fostering, and how do we help do some wraparound services for those families who are suffering. And so how do we do wraparound services for them? So there could be some funding involved with that. And then we're also in the process of looking at really building up the medicated assisted therapy program in the jail. We do get the funding covered for the pharmaceutical for anybody who is a LCO member. Their pharmacy pays for that, but a non-LCO member, that isn't a covered cost. So we're looking at possibly being able to help support the pharmaceutical costs with that. So those 2 numbers are kind of sitting out there, but the overall recommendation would be to budget for $100,000 to both support the family members suffering from trauma, and then also the MAT program, and maybe split between the 2. This went to CJCC last month. I was not able to get my numbers for MAT yet, as I've been out too much this month. But and hoping that we'll be able to just move forward with a $100,000 budget. This committee, I don't think has to vote or do anything. It's really bringing information to you and asking you if you have any comments or questions or recommendations. No?
I guess my biggest
I guess
question
I do,
was.
Julia.
Oh, go ahead, Tweed.
Oh,
Yes.
yeah, Julia, so if a non-tribal inmate, is his MAT medication withheld from them then if there's no money to cover it?
Yeah,
Or
at
does
this
that
point,
inmate have to try to come up with that money to
I'm not-
receive the MAT medication?
at this point, well, so I'm going to just kind of backtrack just a little bit. Right now, if they come in and they have MAT in place, so they have a prescription in place, they can continue to be on that. I don't know if we are continuing that for non-tribal members. I just know that it's not a cover. We're paying for that from the jail. So I don't have a true answer for that, Tweed. The other thing is we don't do induction, which means that if somebody comes in and they are using drugs and they're detoxing and coming off, we could put them on an induction, which means we could start them on Suboxone or one of these meds, which would help them be able to not have as much of the withdrawals, and then it helps later that when they get out of jail, they're less likely to overdose. So that's what we're not doing. We have a big grant. Julie and I will be sitting in with a couple of people from the jail and Becky to be able to develop this program. So we're really in this brand new development phase that I don't really have a lot of dollars and cents around. It's more of what are the best practices? How do we move forward? But I do know that there will be, we are going to be looking at that expense, and we have not budgeted for it in the 2025 budget because we don't know what that expense is for the jail. So that was one of the things.
Question.
Mhm.
Do you have a sense of how many of the inmates are in that situation where they could benefit from getting induction? Because that's a huge life-saving,
I would,
like,
and this is just a rough,
Yeah.
there's so many that are in jail that do have drug misuse. I would guess, I don't know, 50, 60, 70%. Okay.
wow. I think there'll be a really
Yeah.
good use of those.
Yeah.
monies.
And obviously people don't have to do it,
No,
but it's an option that if we're able to get that out there and get them started. The other piece that's happening right now as well is Justice Point has written for the county, written grants for us to be able to get transition coordinators. So once they are up and on the MAT within the jail, we will be able to make sure that they transition into the community directly, like get them, drive them to where they need to go and get them to the places. So all of our ducks are starting to kind of line up here as we move forward. Any other questions? Okay.
Thank you. Any questions? Any further questions? All right. Are there any committee reports, updates? Are there any future agenda items that we want to place on our agenda?
Don't have any.
Can you think of anything, Andy?
I guess the only one thing I would say is that as we move forward into 2025, we will probably be kind of changing up that fiscal packet a little bit. Some things that we track things under don't make sense what we track them under anymore. So we're going to try to make everything more aligned so they make more sense as we move forward. So there'll probably be some changes going into 25 just on visuals, but same data, just in a different context.
I don't have any specific for topics. I think most of it's gonna get caught within our division reports, like with what's going on with the grants and youth justice and restructuring or retooling in the mental health area. It's all gonna get covered there. There's a lot going on, but it'll get covered there.
Okay. Is there any correspondence or reports from conferences or meetings? Well, thank you, everyone. I hope everyone has a wonderful holiday season, and we're adjourned.